Thank you, Senator Kushner, and members of the Public Health Committee and Committee on Children. Thank you for giving me the opportunity to speak in support of SB2 and HB5001. My name is Daniel Pearson. I'm the State Director for Educators for Excellence, a teacher-led nonprofit with nearly 1,000 members statewide that focuses on student equity and elevating teachers' voices in policy decisions. Today, I submit testimony on behalf of our members who are current classroom teachers and educators, and we are grateful that the legislators are putting together comprehensive SEL and mental health bills this legislative session because the traumas of institutional racism, poverty, and violence, and many other factors have plagued our students for far too long. These challenges have gone unaddressed for years, and COVID has only exacerbated the mental health crisis our communities have already been facing. A continuous lack of mental health resources within our schools has proven to be detrimental to our students, and our youth will continue to suffer without comprehensive care and support to address these challenges. Social emotional learning and mental health practices are vital to student success. Without proper mental health support, trauma will continuously impact the student's ability to achieve academic success. Too often, our schools' answer to students who are dealing with trauma is to suspend or expel them, directly contributing to the school-to-prison pipeline that disproportionately affects Black and Brown students. Without the proper investment into mental health support in schools and the sufficient staff to run those programs, we will continue to neglect our most vulnerable students. To ensure our students are receiving the care they need and to prevent school staff from feeling overwhelmed, we need to prioritize proper staffing with manageable ratios and workforce development pipelines. If we are serious about addressing trauma and mental health issues, we need to make the proper investment into the mental health professionals who offer that wraparound service and support for our students. We applaud this bill's focus on creating sustainable workforce development pipelines for individuals to join the mental health field, but we need to further incentivize these individuals to specifically join our school districts and our school systems, as classrooms are typically the first places where students with trauma-related issues can be identified. There are many great ideas being discussed, but none of our innovative programs are going to be effective without sufficient personnel to execute on these plans. For example, the National Association of Social Workers recommends a ratio of 1 to 50 when social workers are providing services to students with intensive needs. But currently, however, many of our mental health professionals in our schools have workloads that make this ratio impossible to achieve due to their incredible workloads. And they honestly, what they do most of the day is perform assessments on students rather than building relationships and understanding the root causes of the students' challenges. So we need to ensure our students are getting the individualized care they need and that our mental health staff have manageable workloads and ratios to effectively perform their jobs. COVID has exacerbated and brought to light the incredible mental health crisis that our youth are facing and have been facing for years. And we need adequate mental health support to excel in school, and teachers need robust professional development, focus on SEL and trauma-informed teaching to help lead these conversations and provide restorative practices within the classrooms.
Teachers Can you hold on, I have to tell this guy, hang on. I'm sorry, Mr.
Oh, sorry. Teachers are often the first to identify when students display challenges or signs of trauma, and they need the mental health support staff and resources necessary to provide these students with the help and assistance they need. Additionally, we need to be sure to incorporate SEL throughout the entire school day, not just in the classroom, but also the bus ride to school, the lunchroom, the after-school programs. Our students should be surrounded by SEL trained and trauma-informed adults. If we do not seize our current opportunity to increase these mental health resources in our schools, we're putting our students at an incredible disadvantage. And with the extreme differences and inequities between school districts, limited access to mental health resources is just another way that we further disenfranchise so many of our youth, primarily Black and Brown students and those living in poverty. We have the power to change this and ensure these students are receiving the care they need. So I urge the legislature and to ensure that there are more mental health staff in schools, provide more mental health resources to students, and equip teachers with the proper tools to serve their students emotionally. And that needs to start now this legislative session. I thank you and applaud the work that has been done and look forward to continuing these conversations throughout the legislative process.